on my feet.
Well, good afternoon, good evening, everybody. My name is Sandy Campbell. I'm the Executive Director of the Santa Fe Council on International Relations, and we are delighted that you've joined us in here. This our third week of conference, where we are into the last 2 weeks of our conference, and this week we are just here today and just here tomorrow. Of course, today we have a doubleheader event later today. At 5:30 p.m., we'll be hearing from Lauren Walsh from New York University, who has some fantastic photographs on how she has covered social crisis. And then at 6:30, we're going to come back here to New Mexico and feature Laura Pascus, who's with New Mexico PBS, who's going to be showing us all kinds of amazing photos of her work in covering our environmental crisis, with a particular focus on how the environmental crisis has affected us here in New Mexico. And of course, one of her big subjects is water. Which is something here we can all identify with how things have been changing over the past number of years. Tomorrow at 10 o'clock Mountain Time, 10 a.m. Mountain Time, we'll revisit our tour of the world with a quick stop in Nigeria, Kenya, and Botswana to understand how coronavirus has reshaped African journalism across the continent. And we'll be hearing in particular from the head of the International Visitor Leadership Program, which is a State Department initiative that many of you are familiar with, that in fact brought the 3 speakers tomorrow to the United States to visit 5 different cities so that they could really sharpen their craft of journalism, learn from American journalists, and then take a lot of that learning back home with them to really improve how they as journalists work. So today, of course, we are talking about New Mexico and New Mexico's responses to coronavirus. And I want to start by acknowledging how brilliantly our state has responded to coronavirus and the amazing people that have all together contributed in tackling this enormous problem, from our governor on down. I want to also acknowledge how incredibly difficult this time has been for all of us, particularly for our poor and marginalized communities, for our elders, and for our tribal communities. Tomorrow at 1 o'clock p.m. Mountain Time, we'll be hearing from 3 young journalists, 2 from Navajo Nation and 1 reporter for New Mexico In Depth, who are going to really walk us through how we've been covering crisis in Indian country. And I think that's a really important conversation, in addition to the many different conversations we're having about crisis and about coronavirus in particular. So let's introduce today's panel. And I want to say hello to today's moderator, Julia Goldberg. Hello, Julia. Welcome.
Thank you, Sandy.
So, Julia, let me ask you super quickly, how difficult has it been for you as a journalist to do reporting today, or to report on coronavirus in particular?
Oh, sorry, you cut out for a minute. What was the first part?
How difficult, how challenging has it been for you to report on really anything these days, or on coronavirus in particular?
I mean, there's obviously the limitation of doing most of my reporting from my house, which is not an ideal situation, since generally one likes to be out a little bit more than that. And then I think the challenge of trying to understand a lot of complex information and make sure that it gets out to people. But I have definitely engaged in what I call stress reporting for the last 9 months, which is in lieu of having anything else to do. I just read and interrogate people all the time, and it's kind of a good stress reliever. So I've been having fun, personal life, but not fun, but.
Very good. Well, thank you so much for not only moderating today's panel, but really putting it all together. We're greatly in debt to you. We'll be showing a little video about the Santa Fe Reporter at the conclusion of today's talk as well. So Julia, let me hand everything over to you, and welcome to all the other panelists.
Thank you, Sandy. Will you unmute everybody, or should I do that? You're doing it. Okay. I'm going to introduce everyone while you unmute them. All 3 of our panelists have such long CVs that I'm going to introduce them briefly, or it would take up the entire panel, me telling you their accomplishments. But I will ask each of them to speak a little bit more about their work in my first question. Dr. David Scrase is Cabinet Secretary for New Mexico's Human Services Department. He is a board-certified internist and geriatrician, a professor of internal medicine and geriatrics at UNM School of Medicine. And as far as today goes, he has been essentially coordinating the state's health and science response to the pandemic. Los Alamos National Laboratory scientist Dr. Sara Del Valle is a mathematical and computational epidemiologist and she works on developing, integrating, and analyzing mathematical and computational models for the spread of infectious diseases. And those include smallpox, anthrax, malaria, HIV, and influenza. She's also part of the team that's been modeling COVID-19 for New Mexico. Dr. Samuel Scarpino is an assistant professor in the Network Science Institute at Northeastern University, where he directs the Emergent Epidemics Lab that engages in research on a variety of topics in complex systems and network science, including infectious disease dynamics, forecasting, and predictive modeling. He's also external faculty member at the Santa Fe Institute, which is how I was lucky enough to meet him. So thank you, all three of you, for being here. As I said earlier, I know how little time any of you have. So I'm just going to jump in with one of my long questions, which is to start that New Mexico, as you all probably realize, has received a fair amount of national attention throughout the pandemic. On the front end, we had everyone from Rolling Stone to Scientific American noting how well we had done by having such restrictive measures in place in terms of warding off some of the worst results. And then now that we're not doing quite as well, there's a story over the weekend comparing New Mexico and South Dakota in terms of New Mexico being very restrictive, South Dakota being very lax, and sort of looking at how different life was on the ground. And so, what I was hoping each of you could do is talk a little bit about what work you have been doing during the pandemic so that people who are joining us who aren't as familiar with you have a sense of that. And Dr. Scarpino, I don't want to limit you to New Mexico. Please talk about your work in Illinois as well, but I know that you have been involved in some of the workshops that SFI has done, so I thought that was something you could mention. But Secretary Scrase, would you like to begin?
Sure. Thank you very much, Julia. Happy to start off. And thanks to everybody who's tuning in today to learn more about what we are doing here in New Mexico. It's been a long run already, over 8 months with coronavirus in the state. My role has, one of the things I like to say is I realized at the first cabinet meeting in 2019, when the new administration came in New Mexico, that I was the only physician. But I didn't really realize what that would mean until early March of this current year, and sort of volunteered my services to help out the Department of Health in addressing the pandemic and working with the governor and her staff to try to provide them with the most reliable modeling, scientific information, and common sense advice that we could about the pandemic. We constituted a team called the Medical Advisory Team, which is a large group, over 150 scientists, physicians. We work with Sara Del Valle and that group with modeling. We have a whole delivery system, an integrated delivery system approach that brings all of our hospitals in the state together to act as much as one as you could expect 40 some hospitals to act. We have a clinical team that looks at medical literature related to therapeutics and makes recommendations there. And we've led the country in remdesivir use because we can distribute that out. I think mainly, though, that ultimately all of that work gets funneled into a set of observations and data about how we're doing as a state. But then I and others bring to the governor and her team to make decisions related to public policy. And so I've had a career as a healthcare administrator, which I described as translating the administrative perspective to physicians and other providers and vice versa. And I think my main role is, again, one of a translator, translating science, medicine, epidemiology into the governor's office and political arena, and then also translating back those priorities and initiatives of the governor into the science-based part of the pandemic and our work to make sure that they are constantly aligned. And I think I'll stop there and let others speak.
Okay. Dr. Scarpino, do you want to go next? I'm just going across the line of how I see you on my screen. So.
Sure, absolutely. It's always a little bit difficult because we see each other in different orders to try to anticipate who we think is going to be next. So thanks so much for inviting me to be here. I'm thrilled to participate in the panel, and I'm sure we'll have more to say about this later, but I think certainly getting an opportunity to interface with journalists has been one of the major aspects of work for us during the pandemic, and I think has really been critical for keeping the public informed about what's a really rapidly moving field in terms of the science and the public health response. The group that I coordinate at Northeastern is primarily involved in building mathematical and computer simulation models of infectious disease outbreaks, and then working with public health officials to translate the results of those models into what we hope are improved public health decision-making and clinical decision-making practices. And usually where the challenges lie are in the data, timely, accurate, informative data that can power mathematical models that support decision-making processes that inform us about the current situation that we're dealing with and what kinds of situations may be unfolding. And in support of those efforts, we've been a part of an international collaboration to capture, digitize, and then share out anonymized individual level COVID-19 case reports, which we've done from about 160 countries, a little over 5 million cases now that we host on a public repository. And this, of course, has been used all over the world and all over the United States for a variety of different public health decision support tools, but also the kinds of tools that we're seeing increasingly as a part of our everyday lives. So the RT.live tracker that informs us, for those of us that are paying attention, of what the current epidemiological scenario is in all of our states, uses data that we've captured as a part of this system to inform the calculations of those parameters. And so that's really what our group tries to focus on. And this was a major part, as you mentioned, Julia, of the convening that we had remotely through the Santa Fe Institute, is to try to understand how we bring together kind of our science, but also our science practice, or the operationalization of our science around COVID-19, to understand what we can offer, both in terms of basic science understanding of the epidemiological, sociological dynamics of COVID, but then how we best learn from the biology and sociology of this pathogen and this pandemic to inform public health decision making. And I think, as we've seen in places like New Mexico, that there are general lessons that we can learn about what works and what doesn't work, but that in particular with COVID-19, the specifics of the state, the specifics of the city, the county, the location that you're responding, they matter in a way that maybe for other pathogens, it's a little bit less important, some of the details. And that's kind of the hallmark of complex systems, the hallmark of what individuals study at the Santa Fe Institute and at Los Alamos National Labs. And so that's the other piece that we've tried to bring to the conversation, is how we really understand the way in which we can translate general understanding, general lessons learned about COVID-19, but applied to the specifics of a response in different parts of New Mexico and different parts of the United States or globally. So I'm looking forward to the conversation. I guess it's this afternoon for me, and thanks again for the invitation.
Thank you. And I should shout out the Santa Fe Institute. Those conversations, I think, are available on YouTube, and they're very interesting and hard, challenging, but interesting. Dr. Del Valle, do I need to unmute you?
I think I did it.
Okay, good.
Can you hear me? Okay.
Yeah.
Yeah, thank you for the opportunity. And I think my role is very similar to Sam's. So I'm going to repeat a lot of the same things. But as a mathematician and scientist at LANL, we have been working very closely with the scientists here and public health officials in developing models that can provide decision support to respond to many different questions. And specifically, I'm working with a team of about 20 scientists, postdocs, and students with many different backgrounds, mathematicians, statisticians, computer scientists, epidemiologists. And it requires a very multidisciplinary team to actually be able to provide the modeling support that we have been doing. As many of you are maybe familiar, we have been forecasting COVID-19 for not only the United States at the state level, but for most countries around the globe. We have been also forecasting hospitalizations for the US and also for the state of New Mexico, we're working on different modeling scenarios on school closures and school reopenings, workplace closures and reopenings too. Early in the spring, we were working very closely on what were the impacts of reopening the economy. And so one of the projects that is also very exciting is on behavior. And as you know, I think behavior has played a critical role in how the disease has been spreading. And even though I think we have been implementing the necessary strategies, it's up to the public, obviously, to comply with face mask usage. And also, one thing that both Sam and I and many folks at SFI and LANL have worked over the years is on networks and how we're the entire world is a network and we're all interconnected. And when you have a disease as infectious as COVID, then this interconnectivity actually plays a critical role in how it is spreading. And so we've been working with a lot of different questions, and not just with the New Mexico Department of Health and the state, but also with other partners such as the CDC and DOE and other federal partners. And most recently, we're trying to work on vaccination distribution strategies and how to best distribute the vaccine so that we can hopefully mitigate the spread quickly.
Thank you very much. I should give credit that Dr. Del Valle told me to wear a mask at the beginning of February. So she was the first person who ever said that to me. And so I have since then, actually. When I spoke with both you, Dr. Del Valle, and Dr. Scarpino, in May, I think, I interviewed you for a story about modeling. And one issue that came up in my reporting repeatedly is that the modeling work itself in epidemiology, it's not new work. It's been going on for a long time, but the way that it's on display to the public is sort of unprecedented and maybe sometimes misinterpreted. And Dr. Scrase, you also have obviously taken a lot of time during the pandemic to explain epidemiology. One of my friends told me it's their favorite part is they feel like they've gone to epidemiology school, as they said. But I'm curious if you have any thoughts of why it's on display to such a large degree during this pandemic, and ultimately if you think it has been helpful to the public to have the volume of scientific information that's been presented by people like myself and others. And I don't know if we want to just, Dr. Del Valle, you were already speaking. Do you want to jump in there and we'll go back the other way?
Okay, sure. I think it's super exciting. And before, I always used to refer to the movie Contagion, yeah. And now I don't have to do that just because, to put it in context. But it's very exciting to see the R naught in many of the different articles, and you just go to, the New York Times or any other, and you see a pretty detailed description about mathematical jargon that you would have normally not seen in these kinds of publications. And I am hopeful that after this pandemic, we will have more people joining the team of scientists and that are actually trying to understand, tackle, and model the spread of infectious diseases. And I think it's been great, not just on the reporting side, but also on the data collection side. I feel like a lot of different organizations have come together to try to provide information to the modelers, from just cases and deaths that they've been able to collect, but also surveys that they're continuously conducting, and that kind of information is very critical for us. So I'm beyond excited to know that now a larger number of people actually understand modeling, and hopefully that will help us in the future so that we have the resources and the tools to help with the next pandemic.
Dr. Scarpino, why now? Why this pandemic, do you think?
Yeah, I think that it depends on which you think was the last pandemic. H1N1 got a little bit of press. The next really, really, really big one was 1918. And so we're now an internet society. I think people are more used to and accustomed to and desirous of accessing information. I think I think particularly folks who watch like the weekly press conferences that the governor and I are on send us a lot of information. I've got a ton of probably retired engineers and others keeping their own spreadsheets of cases in their own zip code. And I think it's the nature of something uh, when we feel frightened or threatened or uncertain about the future. A lot of us, me included, like to gather as much data as we can and see if we can somehow make sense of it or predict what is going to happen. So I think it's a great sign. I think I would acknowledge too that people who don't tune in may not have as much of an appreciation for science. I know one of the articles that came out in May or June was that the biggest predictor of whether or not you wear a mask was whether you believe in science. And I remember reading that and thinking, well, who doesn't believe in science? But now I know. Now I've learned, and there are folks. I think the fact that it's become politicized, yes, and so this gets to the part of is it working or not? I think that science and providing the public with information works to the extent that it doesn't get politicized and is hindered and hampered in terms of people reaching rational conclusions and judgments to the extent that it does get politicized. And my biggest regret in the pandemic so far is that there's additional meaning attached to things like wearing masks. I mean, my analogy is, can you imagine if there was a big national debate along party lines with strong opinions, just really strong opinions on both sides about whether or not people should get hip replacements? I mean, it would be like, it makes no sense. Of course, you can't walk anymore. It's good to get a hip replacement. Everybody should do it. So I think that providing people with information helps them cope with the stress of this pandemic, helps them make their own personal decisions if they want to use that data to do so. And also sometimes I think creates a forum for debate. I just think, New Mexico recently went from one of the lower ranked to one of the higher ranked states in terms of our data that we're producing. And a ton of that improvement really came from questions from reporters like you, Julia, saying, well, how come you're not reporting this or that? And sometimes we were working on it and sometimes we weren't. But in every case, finding that new information and delving into it has enhanced our understanding of the pandemic or our ability to prepare for what's coming next or our ability to expand hospital capacity or whatever. So I want to give it a 1.5 thumbs up in terms of its effectiveness, with that other thumb kind of bent due to the politicization of some of the scientific data that has been coming out.
Okay, thank you. Dr. Scarpino.
I think that one of the aspects about this pandemic, as I mentioned in my introductory remarks, is that it's felt at a very local level in a way that I think is not the hallmark of some of the other pandemics that we've dealt with. So influenza is a kind of disease that's very difficult to control with the types of non-pharmaceutical interventions that we have seen work for COVID-19. But it's also the kind of pathogen where we really expect there's going to be a vaccine within 6 to 9 months, where we have a good manufacturing and distribution pipeline for the vaccine. We have antivirals. We understand something about the treatment protocols. We've stockpiled ventilators. And we're now faced with a pathogen where we understand quite a bit less about its epidemiology, where the way in which super spreading events work means that we're going to often have to have very nuanced responses when it comes to what kinds of things we can have open safely and maybe can't be open as safely. And all of that requires data modeling and really high resolution nowcasts, meaning just an estimate of what's going on now, and forecasts, so what we think may be coming in the future, next week, the week after, so that policymakers can respond adaptively, and so that individuals out in the general public can make the best possible decision around what they can do safely and perhaps what is less safe. I think another issue in the United States is that this is the first pandemic, at least that I've been alive for, where we haven't had a coordinated federal response. And this has left many state and local governments to essentially fend for themselves when it comes to developing response plans, procuring personal protective equipment, understanding what should be open and what should be closed. And this means that the information needs to be flowing down to those levels from many different sources in a way that in the past was maybe going through the US CDC or through other, kind of central federal organizations that were providing guidance to the state and local authorities. And I think that's a big difference as well that we're faced with in the United States. And so and again, I think this is part of the piece for me that's been so important on the journalism side is that means that the number of individuals that need to rapidly become experts in epidemiology and the kinds of large scale simulation models that Dr. Del Valle and her team build just went through the roof essentially overnight. That every city council member, every school board member, every parent needs to have information and be able to make decisions based on what's happening in their local area. So I think that's been another key difference with this pandemic in terms of the role of modeling and data and epidemiology. On the political side of things, one of the pieces that I struggle with, mask wearing certainly has become highly politicized. But I think others, again, we suffer from a lack of a coordinated federal response. So, for example, indoor dining. Indoor dining is still open in Massachusetts, where I live. It's very clear from the CDC and from other studies that indoor dining is not safe. It cannot be done safely with this level of transmission. However, if we close the restaurants, we're going to have small business owners go under. We're going to have individuals that are going to be going without a paycheck because we haven't gotten a restaurant bailout. We haven't gotten another stimulus from the federal government. The state of Massachusetts can't print its own money. And so it's really highly limited in the kinds of interventions that it can take, especially around dining. And so what we're really communicating to the public by leaving dining open is that it's safe. And it's safe to have Thanksgiving with family, which it is definitely not. It is safe to have other kinds of things that look like indoor dining. And so I'm really of the opinion that some things are almost hopelessly politicized, like mask wearing, but other things, people want to do the right thing. We're just not able to communicate to them what that is. And by communicate, I mean indoor dining needs to be closed, and we need to have financial resources available for the owners and the individuals that rely on that sector of the economy. And again, I think a lot of that is coming down to the sort of federal response. So it's this interesting, and again, this is the hallmark of a complex system where it's all kind of connected, as Dr. Del Valle said, in one big network, right? So the need to have local level forecasting, the need to have information flowing down to the local levels, because that's oftentimes where the decisions are made. But then we don't also have that federal level coordination, which takes a lot of measures off the table for local authorities. So I think that it's, again, an even more important opportunity for researchers like myself and others at the Santa Fe Institute and similar centers around the United States to bring to bear our understanding, such as it is, on these kinds of complex systems where there are so many interacting parts that we have to try and navigate.
Thank you. Another area that I think is challenging, at least for me, I'll bring up something that relates to you, Dr. Scrase, which was I had heard from someone more than once who was very concerned that Dr. Scrase often presents sort of articles about medical research as well, current medical research at the governor's news conferences. And you had referenced a study from Duke about neck gaiters, which I don't want to talk about the neck gaiters themselves, but the person who contacted me felt that the study itself had weaknesses. And it made me think about some of the, I guess, controversies that have occurred during the pandemic about reporting on non-peer-reviewed research. So I'm thinking more specifically about the California serology studies, which I think still have some contesting. And so I'm wondering what each of you think about how journalists should take up on reporting about scientific research that is so nascent. And it feels particularly important given what's happening with vaccine approval. You're all probably familiar with the controversy that occurred with some vaccine research early on in the pandemic with, I think, a Lano vaccine researcher. I'm not in a position to read vaccine research and decide if it's valid or not. And a lot of scientists are not going to comment on one another's research necessarily, or if they are, they might not even be in a position to comment on it. So I'm curious how you feel like that information should be presented to the public. And Dr. Scarpino, let's start with you. Now I'm just starting with the last person who spoke because it's easier for me to keep track of.
Yeah, I suppose that I wish I was going first on an easier question. And interestingly, I thought the vaccine news that you were going to bring up is what we're hearing now about the Oxford vaccine, that apparently the higher efficacy report is coming from an accidental dosing that happened, where they apparently were accidentally giving half doses to some of the patients or some of the individuals in the trial, and they just kept going with it. And so that is sort of I think that's a microcosm of what we're all dealing with, right? Which is that the science is moving really fast, and that makes it hard for all of us to keep up with. I think, in addition, the role of preprints, so unpeer reviewed or pre-peer reviewed scientific study, has changed dramatically in this pandemic. So during the Ebola outbreak in West Africa, during Zika and chikungunya, which happened afterwards, there was not this volume of preprints that were being put out. I think, depending on how you count, there's close to 200,000 papers that have been published on COVID-19 since January, which is just an incredible volume of work that is out there. And so I think probably there's not a whole lot that isn't standard operating procedure for most journalism for something that's moving fast, which is to be skeptical and get lots of opinions. So peer review in and of itself is not particularly good at catching fraud. We've seen lots of examples of this going all the way, I mean, not all the way back, but one of the biggest examples is with the measles vaccine and the paper by Wakefield that was fraudulent and went through peer review. So peer review is really not designed most of the time to catch intentional fraud. And so we need to be skeptical sometimes of results that have been peer reviewed. And because of the scientific process, oftentimes things that go through peer review and appear to be correct and stand up to scrutiny will fail in the face of future scrutiny. And so I think leaning on lots of experts, understanding that it's a very rapidly moving field and it's something that we have to continue to stay educated about, but then to keep informing our audiences that the landscape is shifting rapidly, and we need to have the ability to adjust course as we learn what is more accurate and what is less accurate about the science. I mean, the mask wearing piece is a really great example, even before the issue with gaiters, right? Is that I and others wrote pieces back in February encouraging people not to buy masks, and part of that is because it wasn't clear that mask wearing was effective for diseases like influenza. And we thought that was going to be the case for COVID. It was also the case that there was massive supply chain shortages, and we were trying to avoid a run on the bank, so to speak. And then very quickly, the science shifted, showing that masks were very likely efficacious at preventing COVID-19 transmission, that we had pre-symptomatic transmission, which now is overwhelming evidence that the majority of transmission probably happens pre-symptomatic. And all of these raises the importance of mask wearing. And of course, that brings in, as we heard from Dr. Scrase, it brings in the opportunity for, spin and political manipulation and fake news and other things, is that the science is legitimately evolving. But as a result, that means that things that we were saying earlier that were the best possible information that we had at the time may be wrong. And so I think also educating the public about the way science works, especially as during a rapidly unfolding event, is that we are going to be wrong. But we're going to correct that as we move forward, and that we need to be basing our decisions on the best possible information that's in front of us now.
Thank you. Dr. Del Valle?
Yeah, I agree with Sam's comments, and that you need to rely on scientists and modelers to help you kind of navigate that area. The problem that I see right now is that we as modelers are overwhelmed with work, and then we have to review papers or provide comment, and so it's been very challenging to kind of multitask. I get multiple requests to review papers on a daily basis, and this is unprecedented. I would normally get one a week pre-COVID, and now I get multiple requests from friends that are editors, and I have to say no, just because I can't, continue to do my work and then also review papers. And I have to read papers just for my own educational purposes. And so I think there's a larger problem also about the review process that we have in many journals, and because there's a lack of available reviewers also to review those papers, and people need to push the science out in order to hopefully help modelers and decision makers with their questions. Then it's a kind of like a chicken and the egg kind of problem. And so I think that we need to hopefully build more expedite the review process so that people can review and hopefully get their science out. But at the same time, I'm not sure how to deal with the shortage of reviewers, just because everyone who is probably an expert in the field is also working on modeling and trying to provide decision support. And so, for example, for my own team, we haven't been publishing a lot because we're working on the operational part of the problem, which is, you know, trying to help decision makers. And we're putting kind of the publishing on the side, and hopefully once we whenever we get time, we write a little bit of our manuscripts, and then we go back to doing the operational work. So I think as journalists, you guys can just kind of hopefully continue to get more expert opinion from modelers and scientists, and that will help you navigate the field. But as Sam said, the science is shifting and it's very fluid. And so thankfully, I've always been on the right side of the mask, and I always felt I've always had masks since before COVID, and I feel like they prevent you from touching your face, and that's something that I think it's like it's how you get a lot of these infectious diseases. But anyway, I'm gonna stop there.
Dr. Scrase, I'm sure you hear from a lot of people about the articles that you present as well.
Yeah, you know, we had a team at the University of New Mexico for the first 4 months of the pandemic that basically reviewed just about everything and culled it down into a daily report that was amazingly helpful. And as one would expect by what you've already heard from my two esteemed co-panelists, it was exhausting, and they kind of eventually had to stop doing it because they had other jobs and they were trying to fight the pandemic in their own areas. But that was the Global Health Division at UNM. I think I sort of publicly decried the lameness of the medical literature early on. It was the proportion of just preprints, which aren't reviewed by anybody, or non-peer-reviewed articles, was pretty high. Although my sense is it's gotten better. I also think that, you know, one of the things I would say, and I still think it is, you can't just build a public policy, or I would argue even a news report, an unbiased news report, on a single article. I mean, this is called the novel coronavirus because it's new. And we thought that there's some things that turned out that nobody believed that are just like influenza. And there are other things like masks that were mentioned that are different than influenza. So I think my advice to journalists would be to learn some basic jargon about, like, even if it was just like a preprint, not peer-reviewed, or peer-reviewed, or more sophisticated study or less sophisticated study, whatever, then you need people to interpret that for you. And there's a lot of rules about how to do that. And I completely agree with the comments about the peer-reviewed literature as well. It's not all that it's cracked up to be as well. But I guess your problem as journalists is this is of interest to everyone. And like we learned with gators, which that study was not a study about gators. It was a study about how to check to see what kind of masks are better than other kind of masks. And since then, there have been studies using that method to test the different masks more reliably. But it's such intense interest to everybody that I completely understand the irresistibility of just getting it out there. And frankly, the irresistibility to my colleagues in science of just shooting something out as a preprint and getting their 15 minutes of fame without spending 4 weeks revising their paper per the suggested corrections of the editor. And so I think that the incentives, unfortunately, are aligned all across to just get as much as you can out there and let let us let society and science and journalism maybe figure it out later or report it out later. And I think that's done some disservice too, because it's a novel coronavirus, the science changes, and we know a lot now that we didn't know before. And I know folks like who I really respect, like Anthony Fauci, kind of criticized for his initial position on masks, which was, pretty reasonable given the science of the time. And so that's one thing I think journalism can do is really portray the evolving nature of the science and perhaps trace some kind of trend or thread. Follow that thread from the beginning to the present and possibly into the future so that the readers understand that this is new, it's evolving, nothing is written in stone. And after months of time and multiple articles, we get a better sense of what we should be doing. So those are my comments.
Thank you. I think I have time for one more question before we open it up to people who are listening, and it's almost as close as I'm going to get to a yes or no question. Over the weekend, New York Times columnist Farhad Manjoo wrote about contact tracing his own bubble to see how large it was as he tried to figure out whether he and his wife and children could visit his parents for Thanksgiving. And the headline was, quote, "I traced my COVID-19 bubble and it's enormous." And it's really nicely illustrated. It shows how easy it is for even 4 people to, suddenly be connected to a lot of people. And in fact, he concludes, "Once I counted everyone, I realized that visiting my parents for Thanksgiving would be like asking them to sit down to dinner with more than 100 people." And then he decides to go anyway because he feels like he wants to. And so he's going to. And they'll drive instead of fly. And maybe they'll quarantine when they get back. So the outcry to this article was pretty considerable. The comments were just very long. Twitter was aflame. And there were quite a few comments from people in the healthcare industry. And one stuck out at me, someone who identified themselves as an infectious disease doctor who asked the Times to retract the column and said it shouldn't have been published because it's dangerous. And I'm curious if you would agree with that or not, that a column in which somebody pretty smart contact traces, realizes how risky it is and decides to do it anyway, should that be put out there for people to read during a time like this? Dr. Scrase, you're unmuted still, so you might as well answer.
Yeah, I think that one of the things I've learned about the First Amendment rights during this pandemic is everybody. I think there's an onion, and I don't know what you all think of the onion, but sometimes it gives me a good laugh. That why is this latest spike in cases so profound? And the answer is something like, it's complicated, but it has basically to do with your uncle's interpretation of the Bill of Rights. And so, I do think that we are a society. We ought to be able to speak freely. There ought to be different opinions. I would guess, based on what I'm hearing and seeing about airline traffic just this past weekend, that he may be in the majority of Americans. My glib kind of response is that if he was going to go, regardless of what his intensive 100-person contact tracing efforts resulted in, that he wasted his time doing the contact tracing. He could have, one of the things we do as scientists is say, are we going to do something different depending on what answer we get to this question? And but sometimes going through that process helps inform you. No, I don't see any reason why that shouldn't be in the paper. I think that he has a right to his opinion. I think that there will be many Americans who will use it as justification for their own travel this Thanksgiving, knowing in their heart of hearts that it's dangerous, but feeling that emotional tug to be with family. So, my quip on this one, it would be much better for this author and all Americans to have a Zoom Thanksgiving than an ICU Christmas. But I think I would only hope that he would have the journalistic integrity if, and hopefully he won't, he and his family do become infected, or others in his family become infected, to report out on that as well, as part of the follow-up.
All right, thank you, Dr. Scrase. And then we're going to go to Dr. Scarpino, and we'll end with Dr. Del Valle, and I'll say maybe, yeah, we're running into audience questions. So what do you think, Dr. Scarpino?
I'll be brief. I think it's a really tricky issue. It's actually come up with some non-COVID related scientific publications recently, how we should be thinking about calls for retraction. I think that the editorial process should have weighed very carefully what it means for somebody to gather the right kinds of data and then make the wrong conclusion. I think that it's potentially very damaging, although I agree with Dr. Scrase that it seems as though most people who are going to see family have already made up their minds. I think one of the challenges with the CDC's announcement is it came after people had already purchased their turkeys, had already purchased their plane tickets, and I think if we made this announcement maybe a month ago, it might have had a larger effect. And I hope that people understand that if you see family members, you are putting them at risk, you're putting yourself at risk, you're putting the people you travel with at risk. Not everybody has the privilege to stay home, so you're putting the people at risk who work in essential jobs, not just in the healthcare industry, but all of the essential workers or workers that don't have the privilege to stay at home, you're putting them at risk. And I think really weighing those options before you decide to go and see family members in person is something that we have to take seriously, and it's a part of the societal contract that we need to have with each other, that we are all making sacrifices, and that if you choose to act selfishly, that bed that you take up with the ICU unnecessarily could be a bed that somebody with a heart attack would have needed, or a cancer surgery, or all kinds of other things, and that you really just need to think and weigh all of that before you make a decision to travel or to have Thanksgiving outside of your current bubble.
Thank you. Dr. Del Valle?
So I think it's important to hear from both parts of the conversation. And so I agree with Dr. Scrase about, hearing what other people think. And even if we don't agree with those comments, the one thing that I would have maybe liked from the New York Times is to publish, both two separate publications, one where someone made that decision, and then the other one where someone made a different decision or a response to that one, just so that you could actually get the full picture of what goes into making decisions. And I think that way you would give the audience the ability to kind of judge which person they would want to agree with, I guess.
That makes sense. Well, I'm going to jump right into some. We've got a little queue of questions from people who have been listening. We will start with a question from Mary Lou Cooper. She would like to know how we account for New Mexico being a model state early on and suppressing COVID, but now a state with skyrocketing cases. And I will, Dr. Scrase, it seems like that probably is within your purview to answer.
Yeah, no, I'm happy to. Could you say the first couple words? You cut out just for a second. And so,
sure. How do we account for New Mexico being a model state early on and suppressing COVID, but now a state with skyrocketing cases?
So, the question sort of from a scientific point of view comes down to what's the dependent variable that made us successful initially, but how's that behaving now that would be different? I think my overly simplistic way of boiling down coronavirus spread is that human beings spend time in the same space as other human beings and breathe the same air. And so I think really amounted to a lockdown that the governor initiated within days of the first case, closing schools within 3 or 4 days of our first known case, and closing businesses and other steps that were taken to reduce human-to-human interaction actually worked. And we've got mobility data that we track that showed this very, very steep decline. And I think people were willing to do that because At first, we didn't really know as citizens whether this was a threat to us or not. And I think after 8 months, people maybe have grown a little bit, well, a lot fatigued with the coronavirus pandemic. A lot, what we did see early on was very, very serious fatality rates in older people who then kind of locked themselves down for the summer, a big drop off. We saw a huge surge in cases in younger people. We saw a surge this fall in more rural areas rather than urban areas, followed by another enormous surge. And so I think in the end, it's not that the characteristics of the virus itself has changed, but human beings just unable to restrain themselves anymore. We recently have instituted another similar, I think it's called a reset, where we're bringing the level of activity back down. But the mobility that we saw drop like a rock over a 4-week period after, mid-March has only barely moved this time. And so that suggests to me as a sort of leading indicator that people are tired, they're willing to take the risk. And, people tend to minimize some of these risks, especially younger people. So I think it's consistent. I think if mobility had dropped like a rock this time or had stayed low in cases soared, I'd have to come up with an answer. But I think it's just people getting out, spending more time with each other. And, we did open schools, which is a limited contributor to the increasing cases. But, we've had Labor Day weekend. We've always had a rush of cases after holiday weekend. So in my mind, it's consistent, but I sure can't see why the questioner and others would think that it was necessarily inconsistent.
I'm going to jump to another question, and Dr. Scarpino, I think this might have been in response to something you were saying. This is from Barbara Chatterjee, saying, could you talk about the scientific method as an approach to inquiry, with the findings often changing and not necessarily producing hard and fast solutions? I am an epidemiologist, and I find that often we speak of solutions being science or evidence-based, but this often gets simplified, especially in reporting.
Wow, yeah, that's I guess we could have a whole panel conversation on that question. I think one of the things that's important to remember is that, the scientific method is about learning, and learning sort of presupposes that you don't have all the answers to begin with, and that as a result, you may end up with things evolving. In addition, the reality changes, right? I mean, when we first were approached with this pandemic, there were cases in Boston and in New York City, and pretty much the entire country was susceptible. Now we're in a situation where it's all over the United States. There are a lot more individuals that have had it. There's a lot more complacency. We don't have the lockdowns. We have the fatigue. And so while the particulars of the virus itself haven't changed, the environment, namely our human social system that the virus finds itself in, is quite different than it was back in the spring. And so what that means is that the types of policies we may have are going to be different. The recommendations might be different. And so just like we can't really separate the virus out from the society in terms of how we're behaving, in terms of how our societies are structured, we can't really separate out the policy guidelines either. And so I think the part of the scientific method that's important is that it allows for revision and learning and the physicists won't really like this, but I'm just going to say it anyways, as the reality changes. It's not exactly what we mean, but like as the reality changes, it may be that our understanding of the best kinds of responses change. Now, I mean, to the question on the journalism, just very briefly, the details of COVID in terms of the mathematical models are deeply complicated, and that doesn't mean we shouldn't try to communicate them. I think we should. It's just that it is a real challenge and takes a lot of buy-in and communication in order to do that. And so I think we often end up with sort of broad strokes discussion of things just as a result of attention span on Twitter and TikTok and other forms of communication. But I think that we do have to try to engage especially on the policy side, to really make sure that we are giving the best possible information. But it's a challenge.
Although, Sam, I think epidemiology Twitter is really, really useful and interesting sometimes. I know you're on there too, but just I sometimes learn a lot from those threads. Anyway, next question.
I've spent some time on Twitter, that's for sure. Yeah.
This is from Herb Thomas. Does your statistical analysis, Dr. Del Valle, this may be for you, does your statistical analysis go beyond patterns of the virus's spread to the intricacies of the disease itself? In other words, effectiveness of therapies, reasons why some people become long haulers, those kinds of questions.
Yes and no. So we have a lot of different types of models, and the statistical models are usually just using the data to learn trends and forecast the future. But we also have, and those are forecasting models, and we also have projection models. And the projection models take into account all of these other intricacies about therapies and the impact of super spreaders and just the heterogeneity of the spread within a population. And so not necessarily for our statistical models, but definitely for our projection models, we're changing different parameters and trying to quantify the impact of those changes on the overall spread.
Thank you. I think we have time for one more audience question, and I think this one is one probably each of you could speak to, from Karen Baker. With testing as limited as it is, and with so many people defying mask recommendations, what are the chances we can get the virus under control, or do we have to just suck it up until we have a vaccine? Dr. Del Valle, yes, Dr. Scorpino?
No. We're gonna.
Go ahead. So polite. Dr. Scarpino, do you want to jump in?
Sure, I'll be very brief. I think it would be completely unacceptable if we do not correct for the availability of testing, especially with the rapid diagnostic test becoming available. And we're going to have to layer in rapid diagnostic testing, high rates of contact tracing and case investigation with the vaccines that are coming online, and information around mask wearing, so that we can get back to a new normal, maybe even by this summer. But it's going to take a coordinated response. But it really will be unacceptable if we don't close those gaps that were highlighted.
Dr. Scrase?
Yeah, I think there are two aspects of this. I agree completely with Dr. Scarpino's answer about testing. I think we have the means and the way to do that. I mean, I think about when New Mexico pushed into a bold new frontier, going from 3,000 to 5,000 tests a day, and how we thought that was like as good as it could get. We're doing 13, 14,000. We know we need to do about 30,000 a day. So I think that's achievable. I do think, though, that the curves we see, like I was musing this morning, because I think we're going to be, case counts over 2,000 and a rolling 7-day average soon, which may not sound like much to people around the world, but it's really, really high. It's more than 10 times what we would consider a gating criteria for normal life, and those other previous huge spikes we thought we had will just go away. There'll be this background noise that happened 2 to 5 months ago, or 2 to 8 months ago. And so I think ultimately it's people's behavior. It's human beings being with other human beings, breathing the same air, spreading the virus. And so I don't know. I think the answer to the question about whether we think we just have to suck it up to the vaccine delves deeply into each of our own individual beliefs about our competence in our society to take individual personal responsibility to protect ourselves and to protect other people from us. And I think the jury has been out for quite a while on that one, and I may be more pursuant to the question. I don't know if the jury is coming back with an answer on that one or not, but I do think the way to solve this is for people to do what we know everybody knows they're supposed to do, but it's just for a variety of reasons choosing not to do. Not to make people feel guilty, but just we have it within ourselves to make this happen, to turn that curve down. It's not as, I think people have a much more powerful influence on that than tests do.
Dr. Del Valle, may I give you the last word?
Sure. I've been trying to use the analogy of fire. And, you know, we are on fire, our neighbors are on fire, and it would be irresponsible for us to relax if your neighbors adjacent to your house, if their houses were on fire. I don't think you would just take a very relaxed approach. So I think we should take that into consideration when making decisions about our own behavior. And I hope that people will realize that we all need to take the necessary measures to mitigate the spread. And like Dr. Scrase just said, it's this individual behavior that creates the aggregate behavior. And from our modeling perspective, we've seen that when each individual makes the right decisions, you can see the aggregate reduction in the spread. So I hope that people will make the right decisions, especially for the Thanksgiving celebrations, and stay home. And because the virus needs people, and if we don't give people to the virus, then we will be able to stop the spread. So just stay away from people, and that would be the best thing you can do for you and for the community.
Thank you very much. I really want to thank all three of you. I want to thank all the participants and those who sent questions. I'm sorry we didn't get to all of them. I would have loved a 6-hour panel where I could just ask every question I've ever had, but I realized nobody but me would have enjoyed that. So, but thank you so much, all of you, for making time. And I know you'll be hearing from me again, probably shortly, some of you. Sandy, did you have a wrap-up thought?
Well, first of all, thank you so much for taking the time for doing that. That was absolutely fantastic. Thank you, most appreciated, and best of luck to one and all as we get this pandemic ideally under control and a vaccine rolled out. So once again, thank you, and have a great day.